it's CJ. Welcome to week 9 of your pregnancy. Today I'm going to tell you what's happening with your tiny human, what symptoms you might be having and what you can do about them, what symptoms are not okay. And if you stick around, I will tell you the 6 things that I recommend you either do or start thinking about doing while you're busy making a human. Inside of your uterus, your little one is now being referred to as a fetus, and this week is about the same size as a grape. The baby is measuring about an inch from top to bottom, roughly 2.3 centimeters, and weighs about 1 ounce or 3 grams. This week the genitals are being formed, although it's still way too early to see those on ultrasound. The heart now has 4 chambers and is beating about 140 to 170 times per minute. All the major organs are being developed. On the baby's face, the eyes are getting eyelids and the mouth is getting tooth buds, 10 on top and 10 on the bottom. The placenta is just about done being formed, which is really good news, because at week 9, your hormone levels are at their highest, which means your symptoms are at their worst. Once the placenta is fully functional, which is going to happen sometime within the next week, those hormone levels will start to come down, and most of you will start feeling a lot better. In the meantime, it is very normal for you to have nausea with or without vomiting. I recommend small, frequent meals throughout the day. Focus on staying hydrated. Try to eat foods that are not greasy or spicy. If nothing else works, you can talk to your provider about pregnancy-friendly medications. You probably have a heightened sense of smell, which can lead to food aversions, or you may be having food cravings. You are most likely feeling very tired. After all, you are making a human. It's common for you to have constipation. Make sure you're drinking lots of water and adding fiber to your diet. You also may have heartburn. Again, small, frequent meals throughout the day. Try not to lay down after you eat for a couple of hours. And finally, you may be having nasal congestion because of all of those hormones. So, what symptoms are not okay? Cramping that won't go away. Severe pain of any kind that is persistent. If you are bleeding heavy enough to saturate a pad in an hour, or if you have had a 5% weight loss, that is something that your provider definitely needs to know about. So here are the 6 things that I recommend you either do or think about doing now that you're in your 9th week of pregnancy. Number 1, stay well hydrated. Ideally, you want to drink somewhere between 64 and 96 ounces, that's roughly 2 to 3 liters of water every single day. If you are thirsty, you are dehydrated. Number 2, try to focus on eating a diet that is nutritious, including fruits and vegetables, whole grain breads and cereals, lean meat. If you are still feeling really nauseated, just eat what you can. Foods that you should stay away from at this point: deli meat, unpasteurized cheeses, and raw fish. Number 3, gather information regarding what genetic testing options are available to you. Discuss it with your partner so that you can decide what testing you prefer to have. Number 4, now is probably a good time to start investing in some looser clothes. Although you are probably not showing at this point, you may notice that your pants are getting a little bit snug. Number 5, you might want to consider making a pre-baby bucket list. What are some things that you would like to do before baby gets here? And number 6, I hope that you're writing down all of the questions that you and your partner have in anticipation of your upcoming prenatal visit. In the meantime, if there are any questions that I can answer for you, I hope you'll leave those in the comment section below. Oh, and while you're in that comment section, I would also really appreciate it if you'd hit the like button or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.